to all the respected delegates, faculty members, doctors, student, and participant present in today's academic online lecture series. I'm Dr. Jyoti Jat, and it is my pleasure to welcome you all to this weekly lecture series organized by every Saturday by CCRYN Deverkhana Hospital, Jhajjar, under CCRYN Ministry of Ayush, Government of India. Continuing this academic series, today we are honored to have with us distinguished personality and renowned speaker, Dr. Jyoti Keswani ma'am. Welcome, ma'am.
Namaste.
Today's lecture topic is Genesis of Disease. This important topic will help us understand the origin of disease, their root causes, lifestyle related factors, and the naturopathic present, presentive towards health and disease. I'm sure today's session will be highly informative, insightful, and beneficial to all of us. Before inviting ma'am, I would like to brief introduce our esteemed speaker, Dr. Jyoti Keswani ma'am, is a highly respected expert in the field of naturopathy and yoga with rich academic and clinical experience. She has contributed significantly towards holistic healthcare, nature healing, lifestyle management. Ma'am, BNY's MA Yogic Sciences, MD Naturopathy, and PhD Yogic Sciences. She is working as a professor and HOD Yoga Department at Sant Hridaram Medical College of Naturopathy and Yogic Sciences for Women, Bhopal. She has been teaching theoretical and practical aspect of ancient Indian literature, ancient yogic texts, philosophy, applied aspect of yoga, particularly yoga in education and therapy of both UG and PG student. She has employed yoga and naturopathy practices for successful treatment and rehabilitation of the patient, including the victim of Union Carbide tragedy. She is conducting research and also guiding PG students in their mandatory research project. Till now, 5 students have completed their PG research project under her guidance and 2 students are working on theirs. Is also a member of editorial board in Journal of Complementary and Allied Health Research and Frontiers in the Pain Research, Frontiers in Medicine and Alternative Therapies in Health and Medicine. She has published 30 research papers, article, conference paper. She has contributed to the publication of 6 books on subject like nutrition, yoga and physiology. Her book on Sprout in Hindi received award from Madhya Pradesh Rashtrabhasha Prachar Samiti Bhopal. She has served as a member of Syllabus Drafting Board of Higher Education Department, MP Government, and also member of Board of Studies for various universities. She has applied in a various program on health related topic on Akashwani, Doordarshan, Bansal News. Her blog regularly featured on online platform. Most welcome, ma'am.
Thank you.
Most welcome, ma'am. Before we proceed further, I likely request participants to keep their microphone mute and maintain proper decorum throughout the session. Participants may share their questions in the chat box, which will be taken up at the end. Most welcome, ma'am, and please over to you, ma'am.
Thank you. Should I share my screen or you will be doing that?
We will doing that, ma'am.
Okay, you are doing?
Yes.
मुझे बिल्कुल भी साउंड नहीं आ रही है. उनको सुनाई दे रहा है मेरा? मेरा आ रहा था अब.
Okay. Am I audible to all?
Yes, ma'am.
Okay, then I can continue. Shall I start?
Yes, ma'am.
Okay. So today is the time that we should introspect. Just a second. No, I am not very comfortable with these earphones. I will just remove and try once. Huh? Am I audible?
Yes, ma'am, you are audible.
Okay, then I will continue like this. This is better. Today is the time, students and the faculty members who are attending this session, that we should introspect and we should revisit what exactly are the causes of disease, because terms are, you know, talks of the past now, and there are so many factors coming. Everything is narrowing down back to the old sayings which we were following in naturopathy, and modern medicine is gradually coming back to what we have been telling, we naturopaths have been telling right from the beginning. So before, there was a time that these nutritional factors may be the reason, germs are the reason, and so many other things. But all of these things can be narrowed down to a single cause, and that we called as unity of disease. And therefore, we have to think of the ways that we should be. Uh, Slide is not visible for some now. So, and therefore we need to think of the treatments which are basically acting on that single cause of the disease. So, what exactly is the cause for origin of the disease? After so many years of clinical practice, so many of teachings and adding to the degrees, I and having so many personal experiences with health and disease, with patients and with family and with students. So the thing is that that every disease can be traced back to a single cause, that is toxemia, and therefore the treatment also has to be the same. So this explains why so many people benefit just by simple detoxification therapy in the naturopathy sanatorium. And if you remember, it is not very old thing that countries like Europe and America, they used to have sanatoriums and not hospitals, and people used to go and benefit there. And gradually that thing became maybe less fashionable, and we shifted towards the allopathic medicine. And I'm not saying allopathic medicine is bad, but we shifted for what we will say unprudent medication, so that has to be avoided. Can I have the next slide, please? So what is health? Okay, I can change. What is health? So now even WHO is coming to the concept of well-being, okay. And what is well-being? It is a state of complete health on all the aspects, not just one aspect of the health. It has to be not just an absence of disease, but it has to be complete feeling of good on all the aspects, not just okay, I'm not having any disease, so I'm healthy. So not like that. There are so many determinants and so many dimensions of the health, and this was very well explained in Ayurveda, where we know that sama dosha sama agni. If you read this shloka, the first line of the shloka is the physical health, and the second line is mental health. So Sushruta very prudently he explained, he added both physical and mental health in a single shloka. So health is a state where all the components of the body. I will not because everybody knows the meaning and all, and it's written also. So I'll just relate it to the modern thing. So if all the organs are in proper health, all the energies are working, all the metabolic functions are in synchronization, that is the complete physical health, where the food is getting digested properly, the nutrition is getting to go to the different organs and wherever it is required to overcome the deficiencies and all. But apart from that, and along with that, prasanna atma mana indriya swastha iti vidhyate. That means ki the mind should also be happy, even if you do not have any disease in the physical body. If you're not happy, if you're not, then you're not completely healthy. So this is the health, and our modern medicine is gradually coming back to this thing. And this is an indication. You can see the happiness departments where government is trying to make the people happy. Now happiness index is being calculated for countries and for states. So that is an example that we are gradually coming back to our roots. Next. So uh, naturopathy resonates so much with this, and like we say that it's health is a normal and harmonious vibrations of the elements and forces, and it is so true that all the organs, all the vibrations, all the functions should be in sync with one another. So if, for example, very simple example of HP axis. So HP axis, when the mind is not free from stress, it triggers a line of changes where, which goes from the brain to the one gland situated in the lower part of the body, that is adrenal glands, and through that to each and every organ of the body, each and every functions of the body. So it is being affected. So this itself proves, one simple example of HP axis proves that health is a what is a state, health is a state of normal and harmonious vibrations of the elements and forces which make the human entity. Now, and this includes not only physical but all the other dimensions of the health. And then if we say, if we try to remember what Indian Vedas and Upanishads are saying, that yatha brahmande tatha pinde, that means whatever there is there in the nature, in the prakriti, that same things are there in the human and in individual. So again, when everything is fine in the body, but still the nature is not conducive to us, then we start feeling problems. So that's why all the physical forces, the individual forces, bodily forces should be also in the sync with nature. Next. um, what are the causes, yeah, of disease? Before that, what naturopathy believes can maintain a good health and state of well-being. First thing is innervation. That means all the organs should be properly supplied. Okay, whatever efferents and afferents and sympathetic and parasympathetic are supplying, that should be in balance. The tissues are able to receive optimum nutrition, not over nutrition, not under nutrition. So that will help to maintain a proper composition, biochemical composition of the body. And time to time, the drainage of waste products should also be good. That can be from the four eliminative organs, and more than that, whatever elimination mechanisms are there, all are working. And so all these waste products should be removed, because these today's topic was also actually focusing on this particular waste product accumulation only. So we will look into this in more detail in the next slides. Next. So now we said, okay, these are the conducive environment for health. That is, proper innervation is there, nicely nutrition is there, and drainage is also there. And somewhere wherever this is going astray, wherever this is moving from the line, deviating from the normalcy, then we start getting diseases. So we become like, earlier in health we were having a very harmonious vibrations in the body, and also with the nature. And now those harmonious vibration will be inharmonious. So one organ is working hyper, one organ is working hypo. For example, but very classical example, you can say hypothyroidism. Pituitary is doing something and thyroid is doing something. Those closely related glands are not working in sync. So this is an example of inharmony. Next slide. So so why this happened? Why in first place this happened? So we say in naturopathy, you must all be remembering the upas tree also, that we have violated the nature's law. What are the nature's law? So um, following a proper circadian rhythm, proper ultradian rhythm, following the correct principles of diet, correct principles of sleep hygiene, and all these things. These are the nature's laws, which uh, God has, or by default, these are set in our persona. But when we start going away from these, when we start deviating from these laws, nature's laws, we start getting problems. So, what can be the problem? First thing, lowered vitality. We are overindulging in certain sensuous activities, sensory activities. For example, mobile phone, over engagement in the mobile phones. All these things gradually they reduce our vitality. When vitality is reduced, the amount of energy, amount of metabolic energy. If you do not believe in the pranic energy, we can have metabolic energy, amount of metabolic energy required to maintain that composition of the blood, normal biochemistry of the body. Normal biochemistry in terms of stress hormones, in terms of other hormones, in terms of blood sugar levels, in terms of cortisol, in terms of other hormones, so many other hormones. These are all the biochemistry of the body, lipid profile. See, these should be in normal proportions. But if it is deviating from the normal because of the lower vitality, somewhere the function is hyper and somewhere the function is hypo. So it will create a kind of mismatch in the biochemical components of the body. And this will gradually start giving way for accumulation of the waste and morbid matter and poisons inside the body. Now, these morbid matter and poisons, they will go and accumulate everywhere. Initially, as we know, as we have studied, initially the main sites of entry of these poisons are our respiratory system, our digestive system, and gradually they when they are not eliminated for a long time, they will move to the distant locations and they will create problems there. And in terms of, and those problems can be manifested as inflammations, as infections, as like we say that germs are not the cause of the disease. Uh, Morbid matter, it makes the soil, and it makes the soil for the germs to proliferate. Next slide. Uh, so everything till now we talk, it's coming back to one concept of toxemia. Naturopathy described this concept long back, and we are again I'm repeating, but we are coming back to this concept of toxemia in modern terms. And today my effort is to relate the naturopathic concept of toxemia to the diseases which have been identified at present and which are making a quite a workload on the healthcare system. So what is toxemia? So toxemia is the morbid state of blood and tissues resulting from the accumulation of the uneliminated toxins. Now these uneliminated toxins can be actual toxins which have entered from outside in the body, okay, through air, through water, through food, etc. And other which are created, which are composed in the body as incomplete metabolites or faulty as a result of faulty metabolism. So when they are coming from outside, we know these are the exotoxins, and these and it's the world is full of these toxins, we must say, because a very simple thing that plastic which we are using as an integral part of our life now, we are so inseparable from the plastic now. It is continuously introducing microplastics in our body. In it has even reached the brain, it has reached the breast milk, it has reached the placenta. So all these researches are proving, because this bisphenol and all, they are very toxic. Next, the ingested or inhaled pollutants, like we know certain cities of India, they are so polluted. And what can be the health status of those people who are continuously living in those cities? Then um, that is because of the excessive of the ingested chemicals in the air. Then ingested food, we are now this culture of eating outside has also increased a lot, and with so many people living in the PGs and eating outside, eating tiffin service, or eating hoteling and all, it has increased a lot. And that also somehow is like making us more prone for ingestion of artificial additives, preservatives, colors, and these are all chemicals in some form. So see, these chemicals are not of the body. They do not belong there. So when they do not belong there, they are not done with in the body. So they keep accumulating, and body doesn't know how to get rid of them, because that system was not fed in there, because these are new things, and gradually we are increasing the amount of new chemicals inside the body. And these are very so many selfish motives and all. What can we say? The world has become like that. So but we can take care of our own health in a way. We will discuss that also. And pollutants, the water, everything is introducing new things to our body. But maybe because of these toxins entering the body, or some faulty mechanisms inside the body, metabolic mechanisms inside the body, the metabolites in the body, which should have been completely used up, they are not getting used up, and because of that they also get accumulated inside the body. For example, uric acid, which should be converted to the urea, but it is not, so it's causing disease. So these toxins should be dealt with timely and properly and completely. But if it is not happening because of any reason, because we not paying so much of attention to our health, we not eating properly, we not eating healthy food properly, so these will add on to the toxemia. Next slide. So this concept was given by Dr. J.H. Children, and I feel how futuristic of him, and that he told all these things long back. So these toxins, he like are maybe they can be toxic or not toxic also. But whatever toxic matter is there, we know that the liver is the detoxification of the body, and liver works on this, and it converts into protoxin, and then it is eliminated by the body through the eliminative organ. So this is the normal mechanism. But again, that depends on the toxic load, how much toxic load is there, how much liver is able to process all these toxins. Next slide. So if it is eliminated, then it is okay. But if it is not eliminated, or if the intake is more than the ability of processing, then what happens? They cannot be eliminated immediately, and they remove. And also the important thing is how much drainage system or how much elimination system of the person is active, how much function it is functioning. So if it is a very proactive kind of system, then okay, no problem, it is eliminated immediately. But if it is not, then what happens? These toxins waiting to be eliminated in the mainly in the intestine, I would say, and then it will start going to the interstitial spaces and all with the circulation. And these interstitial spaces then are gradually clogged with the toxins, and then whatever function is going on, normal function is going on in that particular area, particular cells, it will start interfering with that function. And as the toxic load start increasing, so the cells will start changing, and this so many mutations and dysplasia, hyperplasia, metaplasia, all these kinds of cellular changes will start taking place. Free oxygen radicals also will take part here, and then all these things gradually deviate us from the normal healthy condition. So Dr. Tilden, next slide. Dr. Tilden said that these things happen in stages. It is not that over the night we start getting go to the most complicated state of the disease. It starts with the innervation. First thing that, like I said, if the system is proactive, if the innervation is proper, if the elimination is good, like the person can digest anything, and it will eliminate, and he will eliminate, she will eliminate also. But if it is not happening because of the faulty nerve supply, innervation in naturopathy, we say it leads to toxemia. That means toxins will accumulate there, gradually start irritating there, as the toxins are accumulating there, it will start interfering with the cellular functions and normal elimination, oxygen, nutrition, and it will cause inflammation. Gradually, it will lead to inflammation, and inflammation will convert to ulceration in due course of time. Ulceration will convert to induration, and then lastly, fungation. So, fungation is the ultimate stage of the toxic overload inside the body. And when the next slide, when the inflammation comes, uh, it will come, it will then to body will give, a nice opportunity for you to deal with this. Okay, so it will start with incubation, it will aggravate as acute disease, it will cause some destruction, but it will also lead to abatement and then finally reconstruction. But the only thing is, are we giving our body this much opportunity, this much window time? So there is something called as natural course of disease. Do we wait for that, or do we straight away take the medicine? So inflammation, as we say naturopathy, initially it's a friend only, and fever is a friend, redness is a friend, all the signs of the inflammation are good only, but only thing is how much we are dealing with that, how much we are able to manage with that. Next slide. um, so now some examples, like I said, ki, these are the old concepts, written in early 90s, like not 90, 18 somethings and all. So how do we see these concepts in present time? Are there any correlations? Are there any new findings which have moved us from the germ theory of disease? So very classic example is leaky gut syndrome. What is leaky gut syndrome? One more thing I will add here is SIBO, small intestinal bacterial overgrowth, which so we know that our gut is full of microbiome. Gut, other parts also, I mean, they are more outnumber our cells, basically the microbiome. And so what happens uh, when we are healthy? Uh, our microbiome is limited to the large intestine. It is doing a lot of functions, right, starting from the fiber metabolism to inflammation to immune modulation, everything. It is participating in every kind of function. Okay. But what happens when the toxins are there in the intestine? The next slide, the junctions between the cells, they start increasing. You can see here. So the tightly packed junctions, they start increasing. Now, these microbiomes, which are normally not harmful, or some of them are opportunistic pathogenic bacteria, but mostly are they are friendly bacteria. They are doing so much of work in our, they start in our, they start leaking in our systemic circulation. First, they cause the local inflammation, and then they start leaking in the systemic circulation, and then they can give rise to a number of inflammatory and autoimmune conditions. Next slide. So this is called as leaky gut syndrome. Now, leaky gut syndrome is nowadays um, being related to the toxins presence of the fermented materials inside the intestine. One more thing is happening, that with that, the intestinal bacteria, which should be localized to the colon, they are moving to the small intestine, and then they are causing inflammation and all. That is called a small intestinal bacterial overgrowth. So that is also not good. Now, what are the reasons for this leaky gut syndrome? So the main is antibiotics, then non-steroidal no, anti-inflammatory drugs. Uh, See, again, I was initially I said how prudently we are using medications, how how often we are using medications, how often we are going for the antibiotics. That also determines your health. Again, alcohol, caffeine, gut irritants, anything. Nowadays, a lot of people are complaining of the bloating of the stomach, and I quite a lot see that. We have this kind of bloating after eating and like that. So I always tell them, just give up wheat for some time, try millets for some time, see if there is any change or not. Because gluten sensitivity is more than more frequent and more common than we think of. Only thing is people never go for gluten sensitivity tests, so that's why they do not know. And see, one more thing, we say that wheat is not ours, so wheat consumption should be actually reduced. Food and beverages, um, we are eating a lot. Again, I was telling that we are eating a lot from the outside, and there we are at more risk of getting the infections, and gradual infections they cause toxin accumulation, irritation, and leaky gut syndrome. Whatever chemicals we are taking, it can be um, monosodium glutamate, it can be artificial colors. If you see the food outside, it's quite colorful, and that color is because of the very harmful chemicals and all. And refined carbohydrates, like again the trend of eating all these candy bars, cookies, all these things also has increased. White bread, so these should be avoided, and these gradually lead to the gut issues. Next. So leaky gut syndrome can be corrected by um, how? First thing, regular elimination. We have many methods of regular elimination. First thing, I always say, because I say, if you're not able to take anema, if you're not able to go for shank prakshalan, why not you just have some uh, salt water, that is also with the senha namak, that rock salt and all, not with the iodized namak. But this iodized salt is also, a questionable thing, because do we need that much of iodine, that daily we need to eat that much of salt and that much of iodine? So we should keep switching between rock salt and iodized salt, if you are living in a geographical area prone to iodine deficiency and all. But if you're not, then maybe you should think of the other alternatives like rock salt and all. Then regular elimination is the key factor for preventing the leaky gut syndrome. uh, it it need not be going to a always going to a naturopathy hospital and getting an enema. And though if it is, if you're able to do that, that's very good, actually, that's very, very good. But if you're not, then try simple remedies at home. Again, those remedies should come from your kitchen and not from the medicine cabinet. Next. Another example of the um, this toxin accumulation and problem inside the body is allergy and hypersensitivity. Next slide. So allergy and hypersensitivity, they have been linked with the um, accumulation of the toxins in the body. Now, these toxins, we say that over the period of time, it doesn't happen in 1 day, 2 days. Over the period of time, they start accumulating the inside the cells, inside the in the interstitial spaces, and then these toxins they lead to the irritation of the cells, and they cause aggravated sensitivity reactions, so hypersensitivity. And the same thing applies for the autoimmune disorders also. So autoimmune disorders and hypersensitivity reactions, they can also be linked to the toxin accumulation inside the body. Next. uh, So next is gout. Gout, we know that it is because of the faulty purine metabolism. The uric acid excretion is not proper, renal abnormalities can be there, and this starts accumulating in the joints, small joints first, and what happens then? It causes severe pain. So if uh, like a very simple treatment, what is told for gout is just stop the protein diet. But along with the reducing of the protein diet, if we go for elimination, which can be simple remedies like water drinking, it can be steam bath, it can be full immersion, but whatever thing you can think of. So kidney pack. So these can help in the removal of the uric acid from the body, along with the dietary modifications. And I think fasting also will help a lot here. And then you can go. But again, this is an example of the endotoxins inside the body. So there was no fault. There was no fault till now, but something happened. Maybe innervation, maybe accumulation of toxin, maybe reduced vitality, whatever naturopathic concepts we say, and it started. It started the fault in the metabolism of the urea. So the whatever thing was to be made, it is not getting made, and another thing in between metabolite is accumulating inside the body and then causing problem. Next. Another example is amyloidosis. Now, amyloidosis is what there is a substance is called amyloid, and um, it is said that if you are repeatedly exposed to inflammation, if you are chronically inflamed, then it causes deposition of these things, and then the cells are going into a malfunction state. And again, this is also quite a serious problem, and it causes a lot of trouble for the patient, and it causes because it will lead to tissue destruction and inflammation, and gradually, and amyloidosis condition will develop, and the patient is quite sick in that. Next. So this is the possible mechanism. Stimulus, then a precursor is formed, then insoluble fibrils are formed, and it is a result of the chronic inflammation, then which causes macrophage activation, and it leads to release of the cytokines, interleukin 1, 6, and which accumulates in the liver cells. Amyloid A protein and serum amyloid A protein is formed, and then it starts accumulating. Next. So now, all these, I can think of so many other disorders also. For example, um Parkinson's disease, Alzheimer's disease, they are also being linked to the accumulation of the abnormal proteins inside the brain cells. Now, these are also a result of the faulty metabolism and result, yeah, we can example of the endotoxin. So you can think of so many other disorders like that, which you can directly relate to the toxins. So, what exactly is the method of dealing with these? Should we straight away go for medicines, or we should try something? So, naturopathic ethics, naturopathic principles, they beautifully describe first thing, ki primum non nocere, that means what? Ki you should not do any harm. I mean, to treat one disorder, do not try to bring or do not make the person prone for other disorder. And that's what is happening with the medications nowadays. One medication, recently completed my thesis research on RA, as a unity of disease and unity of cure. And what I felt, talking to the patients a lot and seeing their prescriptions and all, that after 2-3 months of eating RA medications, rheumatoid arthritis medications, they have to regularly go for liver profile, renal profile, all these things, because no, those medications, they damage the liver and kidneys. And so, if the person is not dying of RA, they will definitely die of the um, renal and liver issues. Then there are so many other side effects also. And you can think of so many disorders like that, where one treatment is going on for one problem, and then another issue is starting, and then it leads to third, and it leads to fourth. There is no end for that. So that's why primum non nocere means that first you should do no harm. If there is a medication less therapy possible, then definitely you should try to go for that. Now, we should also make aware of this to the general population. And I was reading about this CCRYN, CRIYN, especially Jhajjar, and their outreach programs are exactly doing that. They're reaching out to public, and they're reaching out and telling them that these things can be corrected like that. And that's a very good initiative actually. And there we should work. We naturopaths, we are not doctors of the third complicating stage. We should be the doctors of the primordial prevention stage. That we should try first. Yes, of course, we should help at every stage, but I would say that if you are able to help, one population to become disease free without going to the tertiary stage of prevention and tertiary stage of treatment, then we are successful. Then doctor is a teacher, docere. That means we should teach them. We should teach the public. And then again, no, I strongly disagree with this reductionist approach. Why? Because no, we cannot break the person in parts, in parts. No, we are not that kind of puzzle. We are a whole. And so we should treat a whole person, taking into consideration his mind, his body, his senses, everything, his lifestyle should, and then prolecosm, that means treat the cause. Then again यहाँ पर आता है unity of disease and unity of cure. So unity of disease, that means try to narrow down the cause of the disease. Okay, if he's having this problem, what can be the cause? Go back. A very detailed case history taking will help here. Go back and try to find the root cause. So in our research, like in qualitative research, we related the origin of autoimmunity to deep emotional trauma, childhood abuse, or deep pain inside, deep unhappiness inside. So that can be because of anything. So in 17 patients, out of 17, 16 patients, they gave the history of the deep emotional trauma. 17 patient also was there, but little less. Then with medical treatment, that means ki try naturopathy, natural methods of treatment, preventer and well-being. So as I was saying, that we should work on the prevention and well-being. So well-being is like in totality, health in totality and not in parts. Unity of disease, unity of cure, like start with the detoxification and then see for the results. Therapeutic order. Then Arogya Rakshak Panchtantras, they are very, very easy to follow naturopathic way of living and mindful living. Do think what you are doing with your body, with your mind, with your health, and with your family, with your society. Just to think what, how exactly you are living. Next, this is a very interesting principle. Actually, it is very relevant also at present time, and I think every naturopath should follow this, and even other systems. In fact, we should have lectures for allopathy doctors and doctors of the other system, where we can tell them that go in this order. This is called a therapeutic order, and it is very relevant in present time. See, not only it will reduce the disease burden, it will reduce the financial burden on the people, it will also reduce the burden on the healthcare system. So our hospitals are, they are flooded with the patients, and the doctor patient ratio is also less. 1 is to 811, if I'm remembering correct. 1 is to 811. So with this, we need to think of the ways to minimize the people, not minimize, if I say, to at least increase the awareness among people when to go to the doctor or when to go for such taking of the medication and all. So the first is establish the foundation of the for optimum health. यहाँ पर आता है, this comes uh, our primordial and primary prevention. So what are the factors needed for optimal health? Establish that. In case, in terms of nutrition, in terms of the fasting, in terms of how much to apply naturopathic treatment in our home. Not every person can go to the naturopathic hospital to stay for 7 or 21 days. We should think of the small packages also, and we should also think of the home remedies and home treatments which they can do. So with this, I also say that start at the very early age. When you start teaching students at the very early age that this is going to keep you healthy forever, increase the sensitization for the health, that they should be healthy. So it will also help in reducing the healthcare burden. It will help to increase the naturally productivity of the persons. We will have more productive individuals for our rising India. Sorry. Then stimulate the self-healing mechanism. The second order is, if at all, I was talking about the natural course of disease. So that happens only when you give your body some opportunity, support your body. So a simple symptomatic treatment at home, like hot foot bath for something, or chest pack for something, abdominal compress or something, can help. Or simply taking rest also helps. So stimulate the self-healing mechanisms. Here I would want to talk about the vital economy, which is our naturopathic concept. Preserve your energy, do not unnecessarily waste it. And there are so many ways of wasting it nowadays. We have so much of sensory stimulations and dietary stimulation and other kind of stimulation, and stress is an added problem here. Then support and restore weakened systems. Okay, so if you are having already problem, if problem has set in, a little bit problem has set in, then what happens? Then you can support and restore the whatever weak systems are there. So if a system is weak, already weak, then try to support that system by not increasing the load on that. For example, if the digestive system is weak, then what you can do? You can have some moderation in the diet, follow mitahara and yogic concept and all, and then you can gradually will be able to improve that system. If at all there are issues already, address physical alignment. Here we can use our naturopathic systems of massage, chiropractic, acupressure, acupuncture, and we can, um, we say that alignment is very important for health, so that we can add. Natural symptom control. If at all symptoms are there, if I have a symptom of fever, so what I can do, instead of taking a paracetamol, I can go for abdominal compress, cephalic compress. Okay, I can go and take a, tippet bath. Like that, I can have. If I'm having cold, I'm having headache, I can take a hot foot bath. Immediate relief I will get. If the symptom is more than it can be addressed through the natural therapies, then okay, we can go for a synthetic symptom relief. In that case, I will advise, then we can go and take medication till the relief is obtained or when immediate relief is sought. If at all these things are not working, the patient is already in the complicated state of disease, in the tertiary state of the disease, then we can go for, or a surgical intervention is unavoidable, then we can go for high force intervention. So why can't we follow uh, a hierarchy of this treatment protocol? If we follow this, see how many benefits we can get. We can minimize the complications, we can reduce the healthcare burden, we can reduce the undue symptoms and undue complications. We can maintain health with minimum time consumption and minimum money consumption. So there are all benefits of this following this therapeutic order, and I strongly believe that this should be totally absorbed in the complete healthcare system, not only naturopathy but overall healthcare system. We can start with the Ayush, and then we can also motivate others. Next. Then last is, all this will not happen if you are following lifestyle, proper lifestyle. So we know that our lifestyle has become quite devastated, though we live in India, and we are like supposed to be following a very nice Ayurvedic lifestyle because we are from that kind of culture. But are we following that? Are we uh, eating healthy? Are we eating timely? Are we eating less? Are we following mitahar? All these things are important. So Dr. V. Venkata Rao, our naturopath, he very rightly gave Arogya Rakshak Panchtantras, that is just 5 rules and so easy to follow. Very easy to follow. Eat twice a day. Do not eat for more than 2 times a day. Although yoga, some yogic texts, they also tell to eat once a day, but okay, twice we can manage. Twice we can manage. We say that ek bhuktam mahayogi, but dvi bhuktam mahabhogi. But okay, still we will go for the dvi bhuktam wala category में, and that will actually help a lot. Then drink at least 2 seers or 8 to 10 glasses of water in a day. Are we drinking that much of water, or are we avoiding drinking water because we do not have time, or we are simply lazy, or we are to go to the our pot of water? uh, Exercise daily for 1 hour. Are we doing that? Are we leading a sedentary life totally, or are we going for exercise? Any kind of exercise we are doing. Fasting once in a week. So we eat all 7 days. Sometimes we should give, if you are not able to do a full day fasting, at least try for intermittent fasting, which is in trend also now. We can go for 12 hours, or we can go for 8-12, however you like. You start with 12, and then you can go for more. So like this and are we doing anything for our emotional well-being? So prayer twice a day. If I'm not saying that should go and go for temple and sit there for twice a day, for 2 hours every time. No, not like that. But at least bow your head to divine, um, at least once or twice in a day, so that you are maintaining that emotional calm. And if we talk about trend again, prayer is in trend now with bhajan clubbing, and I mean, the youth are so much attracted, and I'm really very excited to see that the youth today is attracted to the divine, to the prayers, and they are going for the bhajan clubbing instead of disco clubbing. So that is actually a very positive sign. And with all that, I am very positive that our youth, the present generation, though they are very much busy with the toxic things also, the topmost comes mobile and internet, but they are also aware about their health. The Gen Z and Gen Alpha, all these are aware about their health, and they are taking small steps to their to health. So I read a lot, and I see people leaving their jobs over happiness, that they are selecting happiness over money. So this actually is a positive sign, and I'm sure we naturopaths have an important role to play in this. And we are actually doctors of the present now. Earlier we used to say we are the doctors of the future, but I would say we are the doctors of the present, and you should grab this opportunity and teach. Like I said, no, naturopathy doctor is a teacher. So we should grab this opportunity and teach people to adopt a naturopathic way of living, a yogic way of living. So with this, I hope that among us, we will start also following the Arogya Rakshak Panchtantras, and in our personal life and in our practice, we'll start following therapeutic order, teach others also, and gradually we will be able to teach everybody. हो सकता है कि in next policies we would be able to follow these kind of practices in our healthcare systems, national healthcare systems. So thank you for giving me this opportunity. I hope everybody understood the concept, and I request you to work on these concepts and develop these more. These are some of my thoughts which I had put forward, but there is so much more to be discovered and explored in this area. So I would really um, request you to work on this kind of toxemia in modern concept, our basic concept of toxemia, work in the modern uh, perspectives. Yes, they will share with the PPT, I feel.
Yes, we definitely, ma'am. Any question regarding today's topic? Anyone? Thank you so much, ma'am, for such enlightening and yes, ma'am. Thank you so much, ma'am, for such an enlightening and inspiring lecture on the topic Genesis of Disease. Your valuable insight, practical explanation, and holistic approach towards health disease have truly enriched our knowledge today. Thank you so much, ma'am. and the way you explain the root cause of the disease and the role of naturopathy and lifestyle management was extremely informative and throughout providing for all of us. On behalf of CRIYN, Deverkhana Jhajjar Hospital, under CCRYN Ministry of Ayush, Government of India, I express our heartfelt gratitude to respected Dr. Jyoti Keswani ma'am. Thank you so much, ma'am, for giving valuable time. And I would also like to thank to all the participants joining online, and hope this series will continue every Saturday and provide you all benefit regarding all the topics regarding naturopathy and yoga. And one more important announcement, in CRIYN Hospital, Deverkhana, Jhajjar, started IPD and OPD with all the naturopathy treatment under expert care. We are having a general ward, deluxe ward, super deluxe ward, experience natural healing and modern comfort at CRIYN Jhajjar. Please come and enjoy it with the natural healing. Thank you. Thank you so much, ma'am. Thank you for joining. And thank you all the participants with this. And thank you. Have a nice day.